Good day, madam. My name is Suchitra, daughter of Chandran, and today I will be presenting an introduction to ethics in psychology. Ethics is a vital foundation of psychology, shaping how professionals conduct research, provide therapy, and maintain their responsibilities. The next is definition of ethics in psychology. Basically, ethics in psychology refer to the moral principle that guides psychologists in their work. This principle ensure that psychologists act responsibly, protect the rights of individuals and promote fairness. Essentially, ethics act as a framework for making decisions that prioritize the well-being of others too. This slide will be explaining about the importance of ethics. Ethics plays a crucial role in psychology by safeguarding the individuals and maintaining trust. For example, number one, confidentiality. Psychologists must protect clients' private information. And the second one is informed consent, which is participants in research must be fully aware of what they are agreeing to. These practices not only protect individuals but also uphold the credibility and professionalism in the field. Now, let's look at the core ethical principle outlined by the American Psychological Association. This principle serves the foundation of ethical decision making in psychology. So, the number one is beneficence and non maleficence. This means promoting well being and ensuring that no harm comes to clients or research participants. The second one is fidelity and responsibility. Psychologists are expected to build trust and take accountability for their professional actions. And third one is integrity. This principle emphasizes honesty and transparency in all professional practices. And the fourth one is justice. It is about ensuring fairness and equal access to psychological service and research. Last but not least, respect for people, rights and dignity. These involve valuing diversity and protecting individuals' privacy and autonomy. Now, let's discuss why ethical guidelines are important in today's world. In today's world, ethical guidelines help psychologists address evolving challenges like digital therapy or cultural sensitivity. By following these principles, psychologists ensure their work remains professional and compassionate, adapting to the changing needs of society. Thank you.
Good day, Professor. My name is Deopriya Biswas, and I will be sharing with you the contemporary ethical and professional conduct issues in psychology. In the next few slides, I'll be highlighting and explaining some points which help us. Let's look at modern ethical challenges and professional standards in psychology. Number one is confidentiality and privacy. Psychologists must remain strictly confidential regarding their clients' information. However, challenges arise in situations where disclosure is necessary, such as when there's a risk of harm to the client or others, or legal mandates like court orders requiring disclosure. Second is informed consent. Psychologists are ethically bound to ensure clients and research participants that they understand the purpose, procedures, risks, and benefits of therapy and studies. Issues include difficulty obtaining informed consent from minor individuals with impaired decision making capabilities, or ensuring participants fully understand the scope of content and consent in the online therapy or telehealth sessions. Third is dual relationships. A dual relationship occurs when a psychologist has multiple roles as a client or research participant. Example, therapist and friend. Such relationships can lend to conflicts of interest, potential harm, or exploitation to the client. Fourth is cultural sensitivity and bias. Psychologists must be culturally aware to avoid biases in therapy or research. Issues arise when stereotypes or unconscious bias influence clinical decision. Standardized tests fail to account for cultural differences, leading to inaccurate assessments. Fifth, research ethics. So, ethical dilemmas in psychological research include using deceptive methods in experimentations without proper justification, ensuring the well being of participants, particularly in high risk studies like studies on trauma or substance abuse, avoiding plagiarism, and ensuring proper attribution of ideas in academic work. Sixth is misrepresentation of expertise. Psychologists must work within the boundaries of competencies. Issues arise when people practice outside the area of expertise without proper training or misrepresent qualifications or credentials to clients or the public. Seventh is technology and online therapy. The rise of teletherapy and online mental health services presents unique challenges. Things like protecting client confidentiality on digital platforms, ensuring ethical boundaries are maintained in less than formal virtual settings. Eighth is managing boundaries in social media. Social media creates new ethical dilemmas for psychologists, maintaining professional boundaries when clients follow therapists online, or avoiding the oversharing of personal opinions that might affect the client's trust. So now we look at some case studies for ethical dilemmas. Like how I mentioned earlier, ethical issues not only underline the ethical issues in practice of psychology, but they also help us find guides and codes of ethics. So we will be using these case studies to explore both the ethical issues and the ethical guidelines that are relevant to the case. For the case in this one, a psychologist is treating a teenager who confides with them about engaging in risky behavior, such as underage drinking and drug use. The psychologist is unsure whether disclosing this to the parents is necessary or if it breaches confidentiality. The key ethical principle over here, as you mentioned before, was beneficence and non maleficence. This can be used here as seeing the way of balancing the teenager's right to privacy and their safety and well being. And the relevant API guideline which will be applicable in this case will be the 4.01, maintaining confidentiality. Psychologists have an obligation to protect confidential information, except in cases where disclosure is necessary to prevent harm or comply with legal requirements. Informed consent gone wrong. A research psychologist conducts a study on memory and includes a minor participant without fully explaining the study's purpose to the child's parents. Later, the parents find out and raise concern about ethical violations. The key ethical principle in this, as we've discussed this before, is respect for people's rights and dignities. Ensuring that participants understand the study and voluntary consent is a big part of this. The relevant AP guideline in this case study would be the standard 3.10, informed consent. Under this, psychologists must ensure informed consent is obtained, providing a clear explanation of the purpose, procedures, and potential risks and benefit to the participants or their legal guardians.
Good day, everyone. My name is Nicole Kwa, and here is my take on discussing about the public responses about ethics in psychology. So for the next few slides, I will be sharing some of the past few cases on public reactions and discussions that affects ethics in the psychology field we have today. So before we jump into talking about the cases, let's just briefly talk about the public perception of psychology ethics. First and foremost, the public trust in psychologists relies heavily on their ethical conduct. So as clients, they value confidentiality, professionalism, and cultural competence. So when ethical principles are upheld, psychologists foster trust, promote positive client outcomes, and advance the reputation of the field. So let's see what happens if some of those ethical principles are violated. So we can see that there are two cases here that depict examples of the consequences. So firstly, we will take a look at the Stanford prison experiment from 1971. So the response to that was about the study's ethical flaws, including the lack of informed consent and psychological harm to participants, led to the widespread public criticism. So this sparked debates about the limits of research ethics and the need for stricter oversight. And for the impact of this was that it strengthened the Institutional Review Board, which is stated as the RIB, requirements and emphasized informed consent. So another example of the past few cases are the case of Dr. Albert from 1920. So the response to that was public and professional scrutiny, questioned the lack of informed consent and the absence of follow-up care for the child subjected to fear conditioning. So the impact to that was that it highlighted the importance of participant welfare in psychological studies. Alright, so let's take a look at some of the responses to ethical violations, and one of it is the therapist's misconduct. So there are cases where therapists violated boundaries, such as engaging in dual relationships or exploiting clients. So this has really sparked outrage and demands for stricter licensing and accountability measures. So this really highlights the need for ethical vigilance and effective regulatory enforcement. So secondly, we will also talk about psychological warfare and the torture. So psychologists' involvement in interrogation practices during the war on terror faced widespread condemnation. And the impact for that is that it led to reforms within operations like the APA, reaffirming commitments to human rights and banning participation in torture. So lastly, and most importantly, we have to really educate and advocate the public on ethics in the psychology field. So first of all, we can raise awareness of ethics in research. So public campaigns often highlight the importance of ethical principles like informed consent and participant welfare, particularly in medical and psychological studies. So for example, discussions following the replication crisis in psychology have emphasized transparency and ethical research practices. So secondly, we can also promote ethical use of psychological tools, advocacy against misuse of psychological assessments in employment, criminal justice, or marketing has really garnered significant attention. In this case, public discussions around personality tests in hiring decisions are starting to focus on biases and fairness. So these are some of the examples we see in modern society and on how ethics is dealt with in the psychology field.
So, to have a better understanding about this topic, we use this case study as an example of this topic. The Toss versus Loftus case is a significant example of ethical dilemmas in psychology. Dr. Loftus, known for her work on repressed memories, faced criticism for her investigative methods. This case emphasizes the complexities of ethical decision making, particularly when engaging with vulnerable individuals. In this case, Jane Doe, later identified as Nicole Toss, accuses Dr. Elizabeth Loftus of breaching confidentiality and ethical standards while investigating Toss' previously published case of repressed and recovered memories. So now we are going to look into the contemporary ethical issues in this case. The first one is informed consent. Participants must understand research scope and risks. The critics argue in here is the consent wasn't fully informed. And the next one is confidentiality. Breaches occurred in accessing sensitive data in this case. So this is a critical issue in modern digital data handling. And the last one is transparency. This case lack of openness about methods. So today's ethical standards demand pre-registration and data sharing. So the case sheds light on informed consent and confidentiality, both essential in psychological practice. And Loftus' work raised questions about transparency, a requirement increasingly emphasized in modern research through measures like pre-registration. We will also look into the professional conduct challenges in this case. Psychologists often face dual-role dilemmas, particularly when balancing research and advocacy. And psychology also need to avoiding conflicts of interest. And the case also highlights the needs of ethical integrity, as invasive methods can undermine trust in psychological practices. So the integrity in methods is ethical dilemmas in investigative techniques and methods must align with professional standards. And now we are going to look into the public responses to ethical issues of this case. So the first issue is trust in psychology. Ethical lapses damage professional credibility. And the second issue is protecting vulnerable groups. Public demands stricter oversight for sensitive populations. And the third one is accountability. Increasing call for transparency in research practices. Public responses to ethical issues in psychology reflect concerns about trust and accountability. Cases like this amplify calls for protecting vulnerable populations and ensuring researchers remain transparent and ethical.
So the takeaway for this case is it illustrates how ethical dilemmas are not always black and white, especially when balancing scientific progress and participant welfare. It resonates us because it highlights the need for vigilance in respecting privacy and ensuring informed consent, even under pressure to achieve groundbreaking research. As a psychology student, we find this case as a reminder that ethical decision making is as critical as a scientific rigor. Next, transparency in research methods is essential to maintaining public trust, and as psychologists, we have a responsibility to continuously adapt to evolving ethical standards, especially with advances like digital data collection. Public responses to this case reinforce the importance of prioritizing welfare over research objective. Next, the lesson learned is involving ethical standard by adapting to challenges like digital privacy and informed consent. Next is strengthening ethical oversight as needed for clear guidelines and professional accountability. So for the conclusion for this topic is ethical challenges remain central to psychology as the public trust depends on transparency and adherence to the standard.